Hi, Amanda. As you know, the Mental Health Commission has put together the Evergreen framework, which is a framework for child and youth mental health. And we've greatly appreciated the contributions of the Youth Council. I'm wondering what your impressions of Evergreen are like.
Well, unfortunately, I wasn't able to participate in the making of the Evergreen framework, but from what I've read of it, I think it's extremely relevant to what's going on today and to changing the mental health system to better help children and youth.
Canadians have told us through Evergreen that the stigma of mental illness is often worse than the illness itself.
I can remember for myself just thinking, there's something wrong with me. Why am I doing this? I can just snap out of it. And then, of course, there's the stigma from other people, from friends, from loved ones even.
Mm-hmm.
When I was hospitalized, I didn't have family members come and see me. Whereas, if I was hospitalized for a broken leg, I know they would come in with get well cards and flowers and things like that.
And we hear all the time from parents and from youth about not knowing where to go if they're seeking services, not knowing how to access services, and then encountering really long wait times.
Well, actually, for my experience, I was really lucky in that I was seeing a counselor at college, and they were able to redirect me to a psychiatrist directly, and I really only had to wait about a week or so. But what I've heard from other people, or friends, or just other patients now, seeing patients, is that it's very hard to see someone, especially if they don't have access to a family physician, which is the case for many people.
And in line with your experience, what we also heard in Evergreen and what I know from experience as a child psychiatrist is the earlier we can identify problems and the earlier we can intervene with problems, the better the outcomes are.
When I was in high school, we never had anyone come in talk about mental illness, and it was like a taboo even in high school. But since I've been diagnosed and I've dealt with my illness, I've joined a group in Montreal, Quebec, where we go to various schools and they'll give about a 20-minute blurb about different mental illnesses, and then they'll bring someone in who has a lived experience, such as myself, just so that they can see that, mental illness is very common, that seemingly normal people can be having difficulties with this, and that they can live successfully as well. So
that's terrific, because hopefully the outcome is that people will feel as comfortable talking about their mental health concerns as they do about headaches and abdominal pain and heart disease or whatever. The other thing that's really important for people who have mental health problems is having a good support system around them.
Well, definitely for support was difficult. When I was diagnosed, I did feel that I lost almost all my friends throughout the process based on stigma and other factors. And actually many of the people who I felt didn't want to support me were future medical students like myself.
Wouldn't it be wonderful if we were able to reach young people before they encounter problems and work with them at preparing them for adaptive coping strategies in life?
We're trying, I know, at the medical school level to change things. I'm part of the medical student wellness group at McGill, and we've recently instituted a wellness day and wellness week for students, where people can learn about their own well-being and mental health and different aspects of it, so that in the future they can help out other people who come to them with mental health issues.
So if we were to look forward to the future, what would we hope for in a mental health system for our children and youth?
I'd like to see prevention and promotion of well-being from an early age, an openness from healthcare providers to talk to patients, to people, to parents, children, everyone about mental illness. I mean, it is so common. There's no reason why it shouldn't be brought up at a yearly health checkup.
I would simply add, we need more resources in child and youth mental health. We need to have a full continuum of services, as you've said, from health promotion and illness prevention and wellness, all the way through to interventional services, using evidence-informed practices, and most important, that these services are actually driven by people with lived experience and their families. Thanks for doing this.
Thank you.